Hi guys, this is Abby, and this is my tummy tuck journal. This is my first entry, so I am pre-op. About 5 days out. My surgery is scheduled for June 19th, 2014. I don't know what time yet. They're going to call the day before and let me know exactly what time to be there to prep and everything else. I'm pretty much ready, I think, knock on wood. Definitely a little nervous, but I think that's to be expected. I've never had plastic surgery before. I don't think I've had any major surgery before. About as exciting as I've gotten is childbirth, and then my wisdom teeth out. So hopefully it goes well. Hopefully I recover fast. But I want to go over a few things with you guys. About my procedure, I will at the end of the video give you guys a before, even though it's a little embarrassing. But basically what I'm having done is a full tummy tuck. They are going to also do some flank lipo, which is kind of your love handles back here. And he's going to, I actually got some additional lipo that's going to go up here kind of under the bust line. And then obviously with a tummy tuck, excuse me, they suture the muscles all the way from the top of your abs all the way to the bottom. So they'll be nice and tight, hopefully. I have a very high navel, so my scar will be a little different than I think most are that I've seen on the YouTube videos when I was researching. It'll come down from hip to hip to right above the pelvic bone, but then it'll also go straight up for about an inch or two, just so that the scar is nice and straight and clean and not as noticeable or wavy or, you know, that kind of thing. So I'm very comfortable with my doctor. I'm seeing Dr. Goldman in Beechwood. That's in Ohio, for any of you that are out of state or out of town. He's very, very professional. I definitely researched a lot of doctors before I decided on him. A couple of girlfriends of mine have had some other things done, and they went to him. They were very pleased. When I went to his consultation, there were a few big things that he did that impressed me. The first of which was that he didn't seem in a hurry. He was very professional, great bedside manner. I asked lots of questions. I actually had 2 consultations, which he said was fine. You know, as long as someone is serious about wanting to have, you know, a tummy tuck, he doesn't mind how many times you come and see him or call the nurses and ask questions. So that was nice, knowing that he is available. He did get on me about smoking. I guess I knew the normal health risks. I'm about a pack, or was about a pack a day smoker. He was nice enough to prescribe me Chantix. I will let you know now, if you do not have health insurance, which I do not, it is a very expensive prescription, coupons or not. You're looking at around $300 just for the starter kit. So I ended up not opting for that, partly because of cost. I just couldn't see myself spending that much, and partly because there are some side effects that come with them. I mean, I never took it, so I can't say for sure, but I've heard it can give you some pretty vivid dreams, and kind of either keep you up or make you not so well rested, which may not be a big deal for most. And I'm sure some people don't experience that at all. But I opted not to because I am a single mom and my sleep is precious. So what I did instead, because he did stress, you must quit smoking, is I got the e-cigarette. So I'm trying that. That's worked really well for me, and I'm kind of stepping down gradually. And then Nicoderm patch for when I just don't want to actually, I try to not smoke at all. So those 2 things kind of help me. Chewing gum, as funny as that sounds, and trying to trick my brain, so every time I want a cigarette, I just go in and brush my teeth. I don't know why it works, but it definitely does help. I think it's something to do with the oral fixation, and my teeth are getting really white. So just little things you could try if you're a smoker and you're looking to get plastic surgery, because they did mention that I believe it's necrosis can occur. Not only does smoking impede the healing process, but it can actually cause your skin to die in patches, and obviously could make you prone to infection, which is the last thing you want, I'm sure, after your surgery. So as he explained it to me, is basically you're breaking a lot of blood vessels and nerve endings and things whenever, you know, they make their incisions, and, you know, all that's got to heal back together, and blood flow is very important. So if you smoke, that's why they want you to stop. It sounds serious enough for me, and I was a pack-a-day smoker. So anyway, enough about that. Let me see. I guess I'll go into my prescriptions. There aren't a lot of them. But I do also have some vitamins that I decided to take. I went over them with my doctor. They're perfectly safe, and they promote healing. Definitely you want to make sure that you get your prescriptions pre-op because I guess he's run into a few patients that either forgot or whatever, and they didn't have their prescriptions immediately following surgery. I don't know why anyone would do that. So I have my Percocet ready to go. I actually asked the doctor specifically for some nausea medicine, which I can't pronounce, but I will let you guys try to figure out that title. But that's just, I mean, I've definitely heard there's nausea. The last thing I want to do is be sick right after abdominal surgery. I couldn't imagine that would feel too good. But I'm also very prone, like when I was going through labor and delivery with my daughter, I was very nauseous. That time of the month I get nauseous. So anything to do with my abdomen and that kind of pain, for whatever reason, makes me very nauseous. So I just kind of tried to take a preventative step. So hopefully that'll work. Couple other things I'm going to be taking that I'm actually on right now. I started 2 weeks pre-op, and I'll continue through my recovery. One, grab the wrong thing first. Multivitamin. It's just a one a day. Women's one a day. He said that that's perfectly fine. Actually, he prefers it if you know, you take a multivitamin daily. I also picked up this Hair, Skin, and Nails. It's kind of a multivitamin. It's got a lot of vitamin A, vitamin C, biotin, zinc, and copper, which pretty much just promote growth and healing for hair, skin, and nails. Obviously, I'm more worried about the skin than anything else. Vitamin E, that's another one. And finally, B12. So those are what I picked up. I may also, later on today, go ahead and pick up just some iron, because he said iron is really good to take. So I'll probably grab that too. Couple things I'm going to have by my recliner, which I'm hoping gets here before my surgery because I just ordered it, are Benefiber, because I heard that it can be very bad if you are unable to use the bathroom. I wouldn't imagine that would be too comfortable, and while it's not the sexiest topic, I do not want to have to try to push out a poop with sutured muscles. So I'm gonna probably take that like religion. I also picked up some Tums because there's gonna be a lot of medication in me, and who knows how my stomach's gonna react to that. Also, just to cut down on any bloating, because obviously I'm already gonna be swollen, I did grab some Gas X. These are just the chewable ones. Trying to think of everything. You are not allowed 2 weeks prior to surgery and at least, I believe, 2 weeks after surgery to take any NSAIDs. So no aspirin, no, I believe it's aspirin, and you definitely can't have any like Motrin, ibuprofen, Aleve, or Advil, which those two were kind of my go-to for regular daily pain, but he said those are big no-nos. They can definitely mess with your anesthesia, because they are blood thinners, so do not take them. He did say that I could have Tylenol, so I will probably use these pretty sparingly. Mostly I got them for whenever I run out of pain meds. They said it's great to have Tylenol on hand. It's kind of a safety blanket in case you're having a little discomfort or pain still. You have something you can take that's safe and it's not going to mess anything up. The other thing I grabbed were some gauze pads. And they're just pretty basic. 12 ply design. I don't know. Just basic sterile gauze pads. And And that's just, again, to kind of cushion. The other thing I grabbed is some, I think they're Carefree panty liners, because everybody seems to like them to kind of put along your incision as a barrier between that and your binder or binding garment. So I'm going to try that. And let's see. Lastly, the binding garment. I purchased, I don't know how well you can see the highlighter. I purchased this one. It's white in the picture. I got it in black. It has zippers down either side. And then, as you can see, it goes from right under the bust to right above the knee. This is what I'm going to be wearing right after surgery and at least for a week. Solid. And I bought a second one so that I'll be able to wash this. And it's not quite as involved. It's just a pretty standard, wrap that goes from here to about mid-hip, and that is for whenever I need to wash the other one, or maybe it's a little, I can imagine that one being a little restricting. So those are my binding garments. I'm trying to think if there's anything else. I bought a recliner. I think I might have mentioned that. I did get one with a massage feature, just because I figured anything that can promote good circulation and blood flow was probably something I wanted. Amazon, great deal on it. I am not a rich person, so I was able to find a pretty good deal. It in black it is $500, and it's push button recline, push button sit up, so I don't have to worry about pulling any levers or doing any of that. I do have help, at least for that first maybe 4 or 5 days. My mom's going to be here. I have a couple friends that are going to be helping me out. I think that's very important. It's something the doctors definitely stressed to me. So I think that's everything I wanted to cover with you guys. I'm sorry if it's a little helter-skelter. I've never done a YouTube video before, so hopefully you guys like it. And I'm going to go ahead and get to the before pictures. Can't wait till they're after pictures, but it's a little embarrassing. Please refrain from any mean comments, but as you can see, my belly button's not very pretty. And when I bend over, it's really not pretty. So, all this is just mush. And then obviously, like right under my bra line, I have some. And right in here. I don't have too much love handles, but a little bit. But, and my daughter's 11. I only have one child. So, I've tried working out. I have tried dieting. I have tried everything. The rest of me gets skinny. The rest of me is pretty slim. I'm comfortable with my weight all over my body except for there. And the doctor did say that a lot of that's just due to your muscles separate whenever, you have a child. So, makes it kind of almost impossible to lose that, and then obviously there's nothing you can do about extra skin besides a tummy tuck. So that's why I'm doing it. I even was in the Army, and that's about the most intense workout I think a person can get, and at least that bottom pooch just would never budge. So I'm hoping that I'll be happy with the results. I'm not really worried about scars. I have scars everywhere, and I don't think they really bother me. Just a nice flat stomach that looks as natural as possible. I think I'll be happy with that. So, alright guys, I hope this was helpful. I will post probably another video here soon, maybe even later today, just to cover a couple of the different things that I asked the doctor about, consultations, things like that. But other than that, thank you guys. Any comments please below, and thank you much.